Hi, I'm Shelley Fold-Nasso, CEO of National Coalition for Cancer Survivorship. In this video, I'm going to talk about our legislative ask for our 2024 Hill Day. There's a separate video that walks through how Congress works and how to structure the meetings and preparing for the meetings. So this video is specifically going to talk about the two pieces of legislation that we'll be talking about in the Hill visits. So for those of you who have attended before our Hill Days, you've talked about one of these two pieces of legislation, if not both. This year, we're actually going to be talking about both the Comprehensive Cancer Survivorship Act, which is HR 4363, which is in the House of Representatives, and S 2213 in the Senate. You don't need to worry about the bill numbers. You just need to worry about the names because you will have a one-pager fact sheet to take with you into the meeting and leave behind with the staff that you're meeting with that will have those bill numbers on it. So don't worry about the numbers, but we will put that on the fact sheet. The other piece of legislation that we're going to be talking about is the Cancer Care Planning and Communications Act, which you've talked about before if you've attended our Hill visits before last year. Last year, we only talked about the survivorship bill because the Cancer Care Planning bill had not been introduced. So the thing that's a little bit tricky about this is that the bills are very similar. The Comprehensive Cancer Survivorship Act includes a bunch of different provisions around survivorship, including cancer care planning. The Cancer Care Planning bill is basically what's in the survivorship bill about cancer care planning, but it's in its own separate bill. So why do we need to talk about both? Well, things are weird in Congress these days. It's really hard to get anything done, and we want to show support for both. We have legislative champions who've worked on the Care Planning and Communications Act for a long time, and it's possible that that is a much smaller bill. It's only one main provision to create this cancer care planning service, and there are scenarios where it might be easier to get something like that passed because it's not nearly as expensive. So it's really important to show support for both. The good news is that it's not really hard to talk about both because the care planning piece is the same in both bills. So it's a little bit confusing, but I know that people who've been to the Hill before can do this. And if you haven't been to the Hill before, you'll have somebody with you who has and who can help you answer questions about it. But I think the main point we're trying to get across is that these two pieces of legislation are both important to help cancer survivors. To help them have a cancer care plan that helps them lay out what to expect during their treatment and after in their transition to post-treatment survivorship. And there are other needs that cancer survivors have, whether they're in treatment or have completed treatment, that also need to be addressed. And we think that both of these bills are really important. So I think that the main point is not to know every detail of the legislation, but to talk about why these, in general picture, why these are important. So now I'm going to talk through each of them. The Comprehensive Cancer Survivorship Act, which is the bill that we talked about last year at our Hill Day. It was introduced first at the end of December of 2022. Every 2 years, we start a new session of Congress. So at the end of this year, 2024, anything that hasn't passed is basically dead. And it would, if you wanted to work on that legislation again in the next Congress, you would have to reintroduce it. So Congresswoman Debbie Wasserman Schultz, who is a cancer survivor and a champion of this bill, wanted to get it introduced in December 2022, even though we were going to be starting a new Congress and it wasn't going to move anywhere that year because she'd worked on it for many years and wanted to get it introduced. So it was introduced in December 22. Then it had to be reintroduced in the 118th Congress, which is what we're in right now. So it was introduced last year in June, right around the time that we were on the Hill with the CPAT symposium. It was she has two lead sponsors in the House, Representative Brian Fitzpatrick, who's a Republican, and Congressman Mark DeSaulnier. So we can say it's bipartisan because of Brian Fitzpatrick. In the Senate, she partnered with Amy Klobuchar from Minnesota and Ben Cardin from Maryland. And there are no Republican leads in the Senate, which we have been looking for and hope to find. And if you have any success with your Republican meetings, that would be great because we'd love to have a Republican who's the kind of co-lead in the Senate on this bill. So what does it do? It really it's called the Comprehensive Cancer Survivorship Act because it has provisions that are wide-ranging to address the health of cancer survivors throughout the continuum of care. from diagnosis to active treatment and post-treatment, and really tries to close some of the gap that survivors face to improve survivorship, treatment, and then that transition for all cancer survivors. So this is a list of some of the things that are included in the bill. And we can point, we're not going to be talking about all of these. This is a lot, and you don't need to know all of these details. When you meet with members of Congress and their staff, they understand that their constituents aren't legislative experts, and they don't expect you to know every detail of the bill. So I can give you a little bit of an overview, and that we have summaries that we can share with them if they want to know more information. But we're really only going to be focusing our comments in the meetings on two of the provisions: the Cancer Care Planning and Communication and the Adult Cancer Survivorship Study. So I'll talk in a little bit more detail about those, but some of the other provisions include some provisions to help with survivorship transition tools, to develop an alternative payment model to incentivize survivorship care, because a lot of times that's a barrier to getting survivorship care, because it's not very profitable for cancer centers to offer survivorship care. So a survivorship payment model may help incentivize them to deliver that. Survivorship navigation and a demonstration program to try to help to demonstrate best practices in survivorship care. There's a provision to help people with employment so that they can continue working while they're going through cancer treatment. A progress report on our nation's kind of efforts in the area of survivorship. Some provisions to ease the transition to primary care for children with cancer. A demonstration model for childhood cancer survivors, and then Medicaid coverage of fertility preservation. So if there's something in there that is really important to you that you want to mention, you can do that. But to make it easier on you in the meetings, we wanted to highlight two provisions, and then you can give them the fact sheet that lists the others. And if they have questions about them, they can come to us to talk more about some of the things that you may not be an expert in, and you don't need to be. So first, for the Cancer Care Planning and Communication. So what this does is creates a Medicare service in payment for care planning and coordination services to help improve that coordination of care and also the transition to primary care. So, cancer care planning is something that we've advocated for a long time, and that as an element of quality cancer care. We think that it's really important both at diagnosis, when you're first diagnosed and have multiple treatment options and decide on your treatment option, a plan that helps you understand everything to expect, to know about the potential side effects and how to address them and who to call if you have issues. And we know that people have those conversations but don't always get a written plan that would help them understand those. And then, especially if that is done up front, then a survivorship care plan at the completion of treatment is easy, because it flows naturally from that original care plan. So we think that's also really important, because right now many people have to get their survivorship care from their primary care physician, and I think there's a shortage of people in oncology, and a move to more cancer survivors receiving their follow-up care from primary care providers. And they really need that survivorship care plan that outlines what your treatment was, what you need to do as far as surveillance for future cancer, or for recurrence of cancer or other types of cancer, what you need to do to help reduce your risk of cancer, and what potential side effects you may look for. If you have that survivorship care plan, then you're better informed to manage your own health, and also to work with your primary care provider to manage your post-treatment survivorship. When we asked a few years ago in our survey, our State of Survivorship survey, less than 20% said they received a survivorship care plan. And without that plan, and I know many of you did not receive a care plan, or some of you had to advocate to get one to help guide your care, but without it, you're left to navigate the cancer diagnosis without a clear direction. And this graphic here just shows as the patient dealing with so many different types of specialists, and having to be that one person that coordinates the care. And a care plan would help you better coordinate that care among all the different specialists that you see. So this provision would create this Medicare service and payment to incentivize and make sure that this care planning happens, because sometimes it doesn't happen because there's not adequate reimbursement for it. And so I already talked about a lot of these, promoting by providing a tangible plan or roadmap, promoting shared decision making, so that you really are understand what to expect and are not left in the dark, empowering patients with the necessary information to manage and coordinate their care, and then helping providers deliver the right care and better coordinate a patient's care. So the other provision that we're going to be focusing on in the meetings is an adult cancer survivorship study. So there is a long-standing study called the Childhood Cancer Survivor Study. A large percentage of pediatric cancer patients are treated through cooperative groups around the country that are, and many of them are in clinical trials. So the Childhood Cancer Survivor Study is a little bit of an extension of that, where they're tracked going forward, and it's a huge source of data for researchers who want to study various aspects of post-treatment survivorship. We don't have anything like that for adult cancer survivors. Many cancer survivors are lost to follow-up. We don't necessarily even know, your primary care provider might not even know that you are a cancer survivor. And there's not necessarily this tracking of the late and long-term side effects that people have from various different treatments. And so this study would help to better understand those effects and create this source of data for researchers to really be able to better understand these long-term effects, to help improve treatments and interventions to increase survival, minimize side effects, and improve quality of life. So since it's been effective in childhood cancer, we think that same thing should be implemented for adult cancer survivors, to help us have that sources of data to help us really improve survivorship care and long-term care. And we know, and all of you know as advocates, that survivors are at risk of developing future health problems. One of the things we ask in our cancer survivorship survey is how many are you still experiencing symptoms today? And we asked, and people even that are 6 to 10 years apart or out of their diagnosis, 69% still experiencing symptoms. And even people who were diagnosed 10 plus years, more than half are still experiencing symptoms. So we know that there are long-term effects of cancer treatment, whether it be medical treatments or radiation treatments, and we don't adequately track and monitor those so that we can help reduce the effects going forward. So that was the Comprehensive Cancer Survivorship Act, and the Cancer Care Planning Communications Act was introduced in August of 2023. So this was introduced after we were on the Hill last year by Congressman Mark DeSaulnier from California. He is a CLL cancer survivor, and he's a huge advocate for cancer survivorship. He is a founder of the Congressional Cancer Survivors Caucus, and he's worked with us on this legislation for a number of years, many years. And he's also, as I mentioned before, he's one of the lead sponsors of the survivorship bill. So again, that cancer care planning piece is in both bills, but this bill is just a standalone bill. He still felt like, as important as the survivorship bill was, that he wanted to introduce this again as a standalone bill, and so he did. So our goal here, I forgot to mention, we have so far 24 co-sponsors of the Comprehensive Cancer Survivorship Act and 11 co-sponsors of the Cancer Care Planning Communications Act. So our goal is to get additional co-sponsors in the House and then ask someone in the Senate to introduce a companion bill. So it's, when you talk about these two pieces of legislation in the meetings, you can talk about the need for cancer care planning and say that both bills would accomplish this, would create this Medicare service, that we think it's important enough that we want to support both bills. And we also appreciate all of the additional provisions in the survivorship bill that takes a really comprehensive approach. It's also, because it's a comprehensive approach, it's more expensive. And that's the question you'll get from a lot of offices, and particularly from Republican offices, is how much does this cost? We do not have a score, which is what they call it when when they do an analysis of how much a piece of legislation will cost. We don't know exactly, but that will be a sticking point for Republican offices and other offices too, but particularly Republican offices, which is why we've had a little bit of a hard time getting Republican co-sponsors for the bill. So the benefit of this piece of legislation is it's smaller and more targeted and would cost less. So we think it's important to show support for both, and that's why we're going to ask you to talk to your members about both pieces of legislation. I hope that this makes sense, and we will have lots of time to answer questions and discuss more on our Q&A call that will be coming up, and then also on Wednesday, June 26th, the afternoon and evening before the Hill visit, so we can answer any questions that you have. Thank you very much, and we look forward to seeing you in DC.